coronavirus vaccine, all things IRMC here this morning. Our conversation brought to you by Marcus and Mack, a law firm representing injured people. You can see it on Facebook right now. Dr. Neff, good morning.
Good morning, Mr. Marino. How are you?
Wonderful. And you?
Thank you. Doing well.
Good. Terrific, terrific. Glad to have you back in the studio with us as well. People keep asking, when's my shot coming? When's my shot coming?
Everyone is very anxious about it, and our biggest challenge right now is vaccine supply, which is still quite restricted for us. We have been able to, however, open up our age group from the 75 and above to 65 and above. So that's one piece of good news.
Yeah. Now, that is because of why? Everybody above 75 has their shot now?
Not everyone above 75 has their shot yet, as far as we can tell. However, we started to see a much larger number of people who were from much farther away that were over 75 that were coming here for vaccine, and we really want to try and focus on Indiana County and those in our region that are directly close to us here that get their care here.
Yeah. Yeah, makes perfect sense. Now, for anybody who falls within the age range 65 and up, you'd love for them to get in line to get a shot from our area, and there's a way to do that, a proper way to do that.
Exactly. It's through the website irmc.org/vaccine. Has the information there about the vaccine and who qualifies and how to sign up. And we really are focusing on those residents of Indiana County and those people who get their care at IRMC, just like lots of other health systems across the western part of the state, as we were talking about.
Yeah, absolutely. And for folks who do not have internet access, which some older folks do not, they can still get themselves an appointment.
They can still get themselves an appointment. We ask that they have some family member or friend or work with Aging Services, Inc. that we're working on to get people that don't have internet access onto the list, and are developing ways to be able to call in. You can call the 724-357-7000 number. That will direct you back to the website, but if you absolutely have to be able to not be able to do that, we still have ways to be able to have people call in to get assistance.
Yeah, we need to tackle this darn supply problem, though, in Pennsylvania. It's not an IRMC problem, it's a state problem, and getting the vaccine out to you. The state says we don't have enough of it, but it's going to be one of those, we'll never have enough of it. But what we have, we need to get into people's arms.
Exactly. It'll be several months. The state is setting out good markers for how to make sure that we get vaccine out in the arms, making sure that the first doses get in to vaccine within a week, and we are well hitting that marker for getting people vaccinated as we can. As you look at the weather today and the danger of driving around today, you go ahead and see why we really want to focus on Indiana County and those people in the area, and you also see how it is dangerous in this time of year to try and travel far distances.
Yeah, absolutely. Which brings us to a subject we were supposed to discuss with a doctor from Fox News yesterday who couldn't get to us because she was stuck in weather.
Wow.
And that question being, when you have vaccine, and they say once you open the box, those vaccines, they have a certain shelf life. They have to be distributed. What happens when you have so many anticipated, but weather delays people getting there, they have to postpone their appointment?
Well, a couple of different things. One, we very tightly control what we take out, so we only take out what we need for the first part of the next day's route to be able to put it in the refrigerator, and that can last for 5 days. Mm-hmm. So we have a good bit of flexibility for like today when we are expecting a number of cancellations. We have the ability to reschedule people over the next week or so, and vaccine that we would be giving out tomorrow, we just use the part of today's allotment to go ahead and use that for tomorrow. So we very tightly control that, and we don't have extra vaccine that we have laying around. One of the things that IRMC has done an extremely good job of is making sure that we don't waste vaccine. We have not wasted a single dose.
Yeah, and do you have a reserve list that get to the end of the day, you've got this, and you call this group of people, or is that not necessary?
In large part, we have gotten to be really good to tightly control the list, so we don't have that many doses at all that are waiting at the end of the day, and we use our standard list. We go ahead and take the same list that we use to go ahead and call people or email people to have them sign up on the list. We use that same list to go ahead and call people to see if they are able to get in within a time period to be able to get a vaccine or not.
The distribution continues to be at the KCAC.
Correct. We're at the KCAC, and we ask, we do not do walk-ins. We will turn people away if they do walk in asking for the vaccine, and direct them to be able to try, and if they need help, we direct them to aging services or to the website to be able to help sign up.
Are there plans in the future to expand to other sites?
The PEMA, the Pennsylvania Emergency Management Association, has put out requests for counties to go ahead and establish other sites for other community vaccination centers, and Tom Stutzman and the county commissioners have asked Tom to go ahead and go forward with developing those plans. Those are probably several months still away.
Yeah, and again, that's going to be a factor of how many vaccines do you have on hand.
Exactly, and it'll be a vaccine supply issue. Just as you see the weather today, we are anticipating all across the country supply problems with getting vaccine, from the federal government to the states, and from the states to the local areas. We've been told that our supply is going to be a little bit unknowable right now.
Yeah, and that's something that we need to take into consideration, is that because we're thinking about people getting to the vaccination site, but the vaccine getting here could be delayed by weather as well.
Exactly. We have plenty of vaccine for the people that we're vaccinating this week, which we're doing a large number of second doses for community members that were vaccinated a couple of weeks ago, and we have plenty of vaccine for that. So we're okay for now.
We talked before, you and I, about how it is that the vaccine actually gets here. Maybe it's a good time to review that, because it really is a fascinating process to get that vaccine here with the special handling that it requires.
Exactly. It comes in a special box with a special tracking electronic device that is connected to the internet. It flies into the airport, I believe at Latrobe, and then is delivered by UPS. And then when our pharmacy director receives it and signs for it, he has to push a special button to say that he's received it and log it into the computer and put it into the freezer. It's a pretty unique kind of system.
Yeah, it's high tech, man.
It is.
We like it. We like it very much. All right. So meanwhile, folks who are very anxious to get their shots but aren't able to just yet, there are things that they can do to insulate themselves from the chance of contracting the virus.
Exactly. This is a multi-pronged approach to go ahead and keep people safe. It's still, mask wearing when you're not able to social distance. It's frequent hand washing, and just being mindful about the situations you find yourselves in as far as crowding and other situations. Just trying to be safe and keep our elderly and sick as safe as possible.
Dr. Richard Neff is with us. He's the Chief Medical Officer at the Indiana Regional Medical Center. We're talking about COVID-19 and the vaccine. We're still Pfizer and Pfizer only at IRMC right now.
At IRMC, we are Pfizer and Pfizer only. Some of the local pharmacies have the Moderna vaccine, and I know that the Punxsutawney Hospital had a supply of Moderna as well, but we're Pfizer only right now.
Yeah, and you don't really receive any guidance ahead of time from the state as to what you're going to get or if there's a different kind coming.
We will get a couple of days' notice that we're about to receive a supply, and I know the federal government and the state are working on getting each other and the local hospitals and pharmacies a better guidance of what they're doing. It is a work in progress and a massive undertaking.
I know that since the beginning of the pandemic, there have been daily meetings, numbers of daily meetings between IRMC staff and leaders about dealing with the pandemic. It's very, very many issues. If you would spend a little bit of time talking about guidance from outside, from CDC, from the State Department of Health, and how that communication is able to be accommodated.
We've really been following what the CDC and the Pennsylvania Department of Health has been recommending, and it's still getting back to the same old true things of social distancing, hand washing. There's concern about the variants that are out there, and I think the same restrictions apply, the same recommendations apply as far as social distancing, hand washing, and mask wearing when needed.
Are you able to communicate directly with a person at the Department of Health, for instance, and say, hey, these are some of the things that we have maybe fresh questions about, or they contact you and say, this is something new you need to be aware of?
We are getting notifications from a number of different channels, and they are able to communicate back with people from the Department of Health. And that's a new change with the new leadership that has been recently installed at the Department of Health, and it's quite refreshing.
Yeah, IRMC, or rather the Department of Health, has had a number of different sea changes, if you will, where they have said to themselves, okay, let's change the way we're doing this. Let's put this new system in place and get all these different things going. What is when they do those sorts of things? What is the reaction locally? Are they great changes required from you when the Department of Health puts a new system in place, new protocols?
The restrictions and directions that the Department of Health has put in are largely more basically just going ahead and giving us stronger guidance to do what we've been doing already. And so if anything, it is just confirmation that the good work of the leaders at IRMC and the staff that have been doing it have been doing the right thing. And so that has been very heartwarming to see that.
There's a lot of reiteration going on.
Exactly.
Dr. Richard Neff with us. Okay, anything else folks need to know this morning?
I would just say that people need to know that when they do get the second vaccine, that there is, a potential for them to have a significant immune response. And what it is the body going ahead and reacting with the vaccine and getting ready to go ahead and be able to fight the virus off. It can be a mild headache, can be fevers and chills, and can be muscle aches and bone and body aches. But that is part of the normal immune response and should be, in some ways, it's suffered through, but also celebrated because it's saying that your body is getting prepared to go ahead and fight this virus.
Yeah. Now, you and I are physically distanced in the studio this morning. When we think about folks who have had that second vaccine, and we don't want them to think, I'm Superman now, and
correct,
nothing can affect me and I can't affect others, that's not really the case.
Correct. It is still quite unknown. We believe that you can still catch the virus. It's the reality of the vaccine is that it prevents you from getting sick enough where you would need to be hospitalized or have serious effects from it, but you can still likely catch it and pass it on. So it's likely that we still need to work on the social distancing and the mask wearing until we know a whole lot more.
He is Dr. Richard Neff. Thanks so much for coming in to visit with us. You headed down KCAC again right now?
I am, and thank you very much.
Terrific. Thanks for coming in.
Yep.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.